Imagine you're standing at the pharmacy counter. You're picking up a prescription. Maybe it's for anxiety. Maybe it's for blood pressure. Maybe it's for something you haven't told your spouse about yet. The pharmacist rings it up. $200, she says. You flinch. You don't have $200. But, she says, smiling, if you use one of these discount cards, it's only $15. She points to a little stand of colorful cards. GoodRx, Single Care, Blink Health. It feels like a lifeline. You hand over the card. The price drops. You pay $15. You walk out feeling relieved. You think you just saved $185. You didn't. You just sold your medical condition to a data broker for $185. Because that discount card isn't insurance. It's a data vacuum. By using it, you bypassed HIPAA. You voluntarily handed your name, your date of birth, and the exact medication you are taking to a private marketing firm. Next week, maybe you start seeing ads for high-risk life insurance. Next month, when your car insurance renewal is due, maybe your rate ticks up because the algorithm knows people with your condition have slightly slower reaction times. You thought you were a patient. To them, you're just a collection of symptoms to be monetized. Welcome to the end of doctor-patient confidentiality. I'm Pseudo, and this is Impractical Privacy. Let's start by destroying a security blanket you've probably been clinging to. Most Americans believe that HIPAA is a shield. If you don't know what HIPAA is, I got you. It's the Health Insurance Portability and Accountability Act. Most people believe it means my doctor cannot tell anyone about my health. Wrong. HIPAA was written in 1996. It was written for fax machines, not Facebook. And it has a massive hole in it. That hole is called TPO, which is Treatment, Payment, and Healthcare Operations. Your provider can share your data without your consent if it's for operations. Do you know what falls under operations? Business management, quality assessment, legal services, data aggregation. Hospitals hire outside companies to manage records. Those companies hire other companies to analyze risk. Your chart isn't sitting in a locked filing cabinet. It's flowing through a dozen vendor APIs. And once the data is de-identified, which, if you listen, you know is a lie, re-identification is easy. It is no longer protected by HIPAA at all. It's a commodity. Imagine you walk into a clinic for your annual flu shot. The nurse records your name, date of birth, and the vaccine lot number. All this goes under treatment. That info goes straight into the doctor's electronic medical record, so they know you got the jab. Then the clinic submits a claim to your insurer. That's under payment. So the insurer knows you received a flu vaccine, the exact brand, and the date. Finally, the clinic's business associate, a data analytics firm, pulls the claim to generate a population health report for the health system's quality improvement team. This falls under operations. Suddenly, your flu shot is part of a data set that could be sold to a pharmaceutical company looking to target you with a new antiviral drug. But to be fair, TPO isn't a villain. It's the scaffolding that lets modern medicine function. But when that scaffolding turns into a slide, your private health story can end up on a billboard. Knowing the three legs, treatment, payment, operations, gives you the power to ask, who's running the slide and where are they taking me? And for the record, You are allowed to ask your provider for a TPO breakdown. When you sign a consent form, request a plain English list of what will be used for treatment, payment, and operations. Let's talk about the biggest spy you've never heard of. IQVIA. This is a company that buys prescription data from pharmacies. Billions of records. They know which doctor prescribes what. They know which zip codes consume the most antidepressants. They sell this data to pharmaceutical companies so they can target ads. But pseudo, you say. That's anonymized data. Is it? If the data set says female, age 45, zip code 66014, prescribed bisoprolol on Tuesday, how hard is it to figure out who that is? There might only be one person in that zip code with that prescription. We've talked about data convergence before. If I have your location data from your phone, episode 4, showing you standing in the CVS at 5:02 p.m., and I have the IQVIA data showing a prescription filled at that pharmacy at 5:05 p.m., I don't need a name. I have the match. Since 2020, we've all moved to telehealth. BetterHelp, Talkspace, him and hers. Convenient? Absolutely. Private? Absolutely not. In 2023, the FTC cracked down on BetterHelp for sharing user data with Facebook, Snapchat, and Pinterest. They weren't just sharing names. They were sharing the answers to the intake quiz. Have you ever felt depressed? Yes. Sent to Facebook. Are you struggling with finances? Yes. Sent to Pinterest. Why? So they could retarget you with ads. They installed the Metapixel inside their therapy app. Imagine sitting on a therapist's couch, pouring your heart out, and unbeknownst to you, Mark Zuckerberg is sitting in the corner taking notes. That is the reality of app-based healthcare. These apps are not medical clinics. They are tech companies. And tech companies sell users. But it's not always just the tech companies intentionally selling you out. Sometimes it's accidental. Have you ever gotten a text or an email from your doctor confirming your visit? Your appointment with Dr. Smith is tomorrow at 10 a.m. Great, right? Unless that reminder came from a third-party scheduling tool that never bothered to lock down its API. Picture this. You're leaving your doctor's appointment. The receptionist, while helping you schedule your follow-up, tells you the office just started doing online check-ins. She gives you a reminder card with a QR code. A day before your next visit, you scan the QR code. It takes you to a sleek website titled Quick Check-In, Skip the Reception Desk. One click, you enter your email, your phone number, maybe even a cute selfie for the profile picture. The site promises instant appointment confirmations. No paperwork, no wait time. Sounds like a dream, right? Well, unless the API that third party used is properly secured, it's a nightmare. What the site should do is require a bearer token, validate the patient's session, and enforce rate limits. What it might do if it wasn't set up right is expose something like appointments, patient ID equals, and then your patient ID to the entire internet with no authorization. And that's only half the battle. The data the API returns can be even more problematic. What it should be doing is returning only the logged in patient's upcoming visits with masked IDs. But again, this comes down to how it was set up. If it's set up improperly, it could return full appointment objects such as your name, your date of birth, your medical record number, the appointment time, your insurance provider, and even the reason for your visit. And in a perfect world, none of this would matter. except that we don't live in a perfect world. People know about these open confirmation URLs and have data scrapers set up to crawl these sites daily and pull whatever data they can. The data scrapers don't stop there. They cross-reference your appointment data with things like public property records and political party affiliation. They then package everything into a health risk score product and sell it to insurance firms, marketing agencies, and even political consultants. And that's all from a well-meaning third-party vendor whose only transgression was setting up an endpoint incorrectly. Okay, we need to tie all this back to the pseudoverse. How does it connect to everything else we've talked about? How does it connect to bossware and cars? It creates the total risk score. Insurance companies are dying to get this data. If your car tracker says you drive late at night, and your bossware says you're typing erratically, and your discount card history shows you stopped buying your meds 2 months ago, that's a red flag. They won't deny you coverage. That's illegal, at least for now, but they will adjust your premiums. They'll deny you your life insurance application. Or if you're applying for a job, you might just get filtered out by an AI that decides you're a high-cost employee. You won't even know why you didn't get the interview. You'll just be a statistical liability. And it goes even deeper. We touched on this a bit in episode 7 about AI. Let's say you Google a few symptoms of something, or maybe you're working through a health problem with your favorite chatbot, like Gemini or ChatGPT. And finally, based on the responses you get, you work up the courage to go to the doctor. The doctor visit goes well and diagnoses you with exactly what ChatGPT said it thought you had. You're thrilled because there were no surprises in your visit and you were mentally prepared for the outcome. You then go to the pharmacy and pay with cash, like we've discussed, because you listen to this podcast and you value privacy. Except Google or OpenAI or Meta are now just as looped in as your medical provider. And the rabbit hole goes deeper. These chatbots are fantastic at sounding supportive and friendly and caring. So much so that some people are using them in place of actual therapy sessions. Let's go back to Mark Zuckerberg sitting in that corner. But instead of him taking notes, he is the therapist. And to top it off, Meta hasn't exactly proven itself to be responsible stewards of people's emotions and has actively worked to monetize them. So, other than HIPAA, which has some holes, what laws are in this space protecting medical information? It turns out there are several, but they don't add much value that you didn't already expect. There's the HITECH Act of 2009, which strengthens HIPAA. It mandates breach notifications and promotes electronic health records. There's GLBA, which regulates financial institutions' handling of non-public personal information. Basically, if a health-related expense shows up on a credit report, GLBA may apply. Section 5 of the FTC Act prohibits unfair or deceptive practices, which are often used in privacy promises. And the 21st Century Cures Act of 2016 forces providers to share data with their patients, which is good for transparency, but can also increase exposure if it's not done properly. So here in the US, there isn't much more that protects your health data that you didn't probably already know or assumed was in HIPAA. What about our friends elsewhere? The European Union has the GDPR, which is the General Data Protection Regulation, which, again, is the gold standard for personal data protection laws. It covers consent, right to erasure, data portability, strict penalties for companies that violate this stuff, up to 20 million euros or 4% of global revenue, whichever number is higher, covers all personal data, including health data, which is treated as a special category within the GDPR. The United Kingdom has the UK GDPR Plus Data Protection Act of 2018. This mirrors the EU GDPR after Brexit. Some heavy-handed enforcement, basically. Canada has the Personal Information Protection and Electronic Documents Act, plus provincial health privacy statutes. It's consent-driven with specific rules for health information. Australia has the Privacy Act of 1998. This regulates health information as a sensitive data type and requires higher standards for protection. Brazil has the LGPD, which was modeled after the GDPR, includes the same special category for health data. South Africa has the Protection of Personal Information Act, which focuses a strong emphasis on lawful processing, especially for health data. Japan has the Act on the Protection of Personal Information. They revised it in 2022 to tighten healthcare data protections and cross-border transfer rules. And last up, India is working on, but not yet passed, the IT Act plus Personal Data Protection Bill. As of right now, it just seems to be an emerging framework for this type of data. Currently, healthcare data is covered under sensitive personal data under some other law. On a global scale, the laws in the US regarding data protection for health information are a bit behind our peers in protecting the rights of the person. Reach out to your congressperson if you'd like to see stronger laws passed in this area. Real talk, this stuff is hard. You can't just opt out of being sick, but you can compartmentalize the damage. Tactic number 1, cash is king again. Notice a theme with cash? It's always king. If you have a prescription that is sensitive, something you don't want linked to your identity, and it's generic and cheap, pay with cash. Do not use your insurance. You don't have to. Do not use a discount card. Go to a different pharmacy than your usual one. Give a fake phone number if they let you. Pay with cash. Your data stops at the register. It doesn't go to the PBM, which is the pharmacy benefit manager, and it doesn't go to your insurer. Tactic number 2 is segregate your telehealth. If you use a mental health app, do not run it on your main phone. Use the burner device strategy we've talked before. Create a dedicated email address for that account and use a masked card from someplace like privacy.com. Do not link it to your Facebook profile. Starve the metapixel. Tactic number 3 is the paper request. When you go to a new doctor, oftentimes they'll hand you an iPad to sign the forms. Ask for paper. Read the privacy notice carefully. Look for the section on business associates. Cross it out. Write, I do not consent to sharing data for marketing or third-party analytics. Will it work? Who knows? Maybe not. But it does put a flag on your file. It makes you a difficult patient. And in the data world, being difficult sometimes means being ignored, which is exactly what we want. Tactic number 4 is direct-to-consumer labs. If you want to check your blood work, but you don't want it on your permanent insurance record, use a direct access lab service, like Ulta Lab Tests or Walk-In Lab. You do pay out of pocket. You go to Quest or LabCorp. The results go to you, not to your doctor, not to your insurance. You own the data. Funny enough, literally while writing this episode, a friend of mine was talking about going to a private lab for their blood work. Their motivator was getting the exact test that they wanted without going back and forth with their provider. So, private labs do have multiple benefits. I know this sounds extreme. Pseudo, you're telling me to pay cash for medication. I'm telling you that in a system designed to strip mine your life for profit, privacy carries a surcharge. Sometimes paying $20 for a generic pill is cheaper than saving 15 and having that prescription haunt you for the next decade. The medical system treats you like a data set. Treat yourself like a trade secret. Check the show notes. I've linked to the FTC report on BetterHelp and a guide on how to scrub your medical history from the Medical Information Bureau. Yes, that is a real thing. Next week, we're going to look at the one place you thought was safe, the school. We're going to talk about the spy in your kid's backpack and how EdTech is grooming your kids for the surveillance state. And don't forget, big fan subscribers on Patreon get an extra episode every month on the second Monday. I'm Pseudo. This is Impractical Privacy. Stay skeptical, stay safe, and remember, an apple a day keeps the doctor away, but it won't keep the data broker away. Just like forest fires, only you can prevent that. Oh, and before you go, why did the HIPAA officer break up with the X-ray technician? She said she saw right through him. I know, that was bad. It hurts me to have to come up with these every episode. I'll see you next week.